Hello everyone, now let us see the class 4 of CPC training course. In the current session, we will be discussing the basics of anatomy of digestive system part 1. And the video is available in the playlist CPC training course. As of now, digestive system is a vast topic and we will be covering it in 2 classes. In the current class, we will be discussing about the introduction, layers of GI tract, peritoneum, mouth, pharynx, and related clinical significance wherever applicable. We will be discussing few of the pathologies. And the mouth includes tongue, teeth, and salivary glands. First of all, coming to introduction, digestive system contributes to homeostasis by breaking down the food into forms that can be absorbed and used by body cells. It also absorbs water, vitamins and minerals and eliminates the waste from the body. And the medical specialty that deals with the structure, function, diagnosis and treatment of diseases of the stomach and intestines is called as gastroenterology. Gastro means stomach, entero means intestines. So gastroenterology is the medical specialty that deals with the structure, function, diagnosis and treatment of diseases of stomach and intestine. And the medical specialty that deals with the diagnosis and treatment of disorders of rectum and anus is called as proctology. Procto means rectum. So proctology deals with the disorders of rectum and anus, whereas gastroenterology deals with the disorders of stomach and intestine. Now coming to the organs. Two groups of organs compose the digestive system, the gastrointestinal tract and the accessory organs. The organs of gastrointestinal tract are mouth. Though mouth is here, as it contains the accessory digestive organs like teeth, tongue and salivary glands, it is not a part of gastrointestinal tract. It can be considered as an accessory digestive organ. But still, it is the place where GI tract starts. So mouth is considered as a part of GI tract. It is a little confusing, so don't get confused. Some authors, they include the mouth in the gastrointestinal tract organ and some authors, they don't include. As of now, GI tract or alimentary canal, it is also called as alimentary canal. Alimentary means nothing but nourishment. The GI tract is called as alimentary canal because it provides the nourishment to the body cells. And it is a continuous tube that extends from mouth to anus. GI tract is a continuous tube that extends from mouth to anus. This entire area is called as GI tract. Through thoracic and abdominopelvic cavities. We have discussed about the cavities in the previous class. And organs of gastrointestinal tract include mouth, most of the pharynx, esophagus, stomach, small intestine and large intestine. Whereas the accessory digestive organs, they are indicated in the red color. Accessory digestive organs include teeth, tongue, salivary glands, liver, gallbladder, pancreas. Here you can see mouth is also indicated in the red color in the diagram. Though he is adding mouth as an organ of the gastrointestinal tract because it contains teeth, tongue and salivary glands. The salivary glands are sublingual glands, parotid glands and submandibular glands. There are three pairs of major salivary glands. They are sublingual, parotid and submandibular. The next is pharynx, esophagus, then stomach directly. Here you can see liver. Liver is indicated in the red color. It is an accessory digestive organ. Similarly, gallbladder, the green color one, is also indicated in the red color. This is also accessory organ. And pancreas. This is also accessory organ. The black color ones are all organs of gastrointestinal tract. Now coming to the functions of digestive system. Overall functions. The first one is ingestion. That is taking of food into mouth. The next is secretion. Release of water, acid, buffers and enzymes into lumen of GI tract. Mixing and propulsion, that is churning and movement of food through the GI tract. The fourth function is digestion, that is mechanical and chemical breakdown of food. Next is absorption, that is the passage of digested products from GI tract into blood and lymph. And finally, defecation, that is nothing but elimination of fecus from GI tract. These are the functions of the digestive tract or digestive system. Now, coming to the layers of the gastrointestinal tract, there are mainly 4 layers for GI tract. They are mucosa, submucosa, muscularis and sclerosa. Here you can see inner part. This is mucosa. The next layer is submucosa. This is the gray color one. The next is muscularis. Below submucosa, it is muscularis, where you can find the yellow line. This is muscularis. And finally, sclerosa. The 4 layers of the GI tract from deep to superficial. The deepest layer is mucosa and the superficial layer is sclerosa. Deepest layer is mucosa and the superficial layer is sclerosa. From deep to superficial are mucosa, submucosa, muscularis and sclerosa. The order is from deep to superficial: mucosa, which is the innermost layer, next followed by submucosa, next followed by muscularis, and then followed by sclerosa, which is the outermost layer. These are the 4 layers of GI tract. Now coming to the steps in digestive process, the digestive process mainly has 4 steps. The first step is ingestion, intake of food. It starts in the mouth. The next step is digestion, that is nothing but the breakdown of food particles. It starts in the mouth and ends in the small intestine. And finally absorption, that is absorption of nutrients from the digested tract. It occurs in the small intestine, especially ileum. And final step is elimination, that is nothing but defecation. It occurs in the large intestine. Now coming to peritoneum. The next topic is peritoneum. We have completed the introduction. Now coming to peritoneum. Peritoneum, peri means around. Peritoneum is the largest sclerous membrane of the body. Peritoneum is the largest sclerous membrane of the body. Peritoneum is mainly divided into 2 layers, parietal and visceral. The parietal peritoneum lines the wall of the abdominal cavity, and visceral peritoneum. Visceral means internal or inner. In other words, visceral, it covers some of the organs in the cavity and their sclerosa. Now the slim space containing lubricating serous fluid, that is between the parietal and visceral portions of the peritoneum, is called as peritoneal cavity. Between parietal and visceral peritoneum, there is peritoneal cavity. In certain diseases, the peritoneal cavity may become distended by the accumulation of several liters of fluid, which is a condition called as ascites, and including the kidneys, ascending and descending colon of the large intestine, duodenum of the small intestine and pancreas are said to be retroperitoneal. The peritoneum is important for the determination of location of certain organs. In sometimes the physician indicates it is a retroperitoneal organ. What are the retroperitoneal organs? Retro means behind. The organs which are behind the peritoneum. They are kidneys, ascending and descending colon of large intestine, duodenum of small intestine and pancreas. These are the retroperitoneal organs. And the accumulation of several fluids of peritoneal fluid, accumulation of several liters of peritoneal fluid is called as ascites. It mainly occurs due to the liver damage. Now coming to the folds of peritoneum. Previously we have discussed the layers of peritoneum. The outer layer is parietal peritoneum and inner layer is visceral peritoneum. Between parietal and visceral peritoneum is the peritoneal cavity, and the peritoneal cavity contains peritoneal fluid. Now coming to folds of peritoneum. The folds that bind the organs. What is the function of peritoneal folds? They bind the organs to one another and to the walls of the abdominal cavity. They bind the organs to one another and to the walls of the abdominal cavity. They also contain blood vessels, lymphatic vessels and nerves that supply the abdominal organs. There are 5 major peritoneal folds. How many? There are 5 major peritoneal folds. The first one is greater omentum. The next is falciform ligament. The next is lesser omentum. Next is mesentery, and finally mesocolon. Don't get confused with the term colon, because mesocolon is not a part of colon. It is a part of peritoneum. It is one of the folds of peritoneum, mesocolon. Greater omentum, falciform ligament, lesser omentum, mesentery, and mesocolon. Let us discuss briefly about the folds. The first fold is greater omentum. Omentum is nothing but fat skin. Omentum is nothing but fat skin. The greater omentum, it is the largest peritoneal fold, and it drapes over the transverse colon and coils of the small intestine like a fatty apron. The next is falciform ligament. The falciform ligament attaches the liver to the anterior abdominal wall and diaphragm. The falciform ligament attaches the liver to the anterior abdominal wall and diaphragm. And the liver is the only digestive organ that is attached to the anterior abdominal wall. This is also important. Falciform ligament attaches the liver to the anterior abdominal wall and diaphragm. And liver is the only digestive organ that is attached to the anterior abdominal wall. The next is lesser omentum. It arises as an anterior fold. It arises as an anterior fold in the sclerosa of the stomach and duodenum, and it connects the stomach and duodenum to the liver. Lesser omentum connects the stomach and duodenum to the liver. It is the pathway for blood vessels entering the liver and contains hepatic portal vein, common hepatic artery, common bile duct, along with some lymph nodes. So, which fold of the peritoneum contains hepatic portal vein? The answer is lesser omentum. Lesser omentum contains hepatic portal vein, common hepatic artery, and common bile duct, along with some lymph nodes. The next type of fold is mesentery. It is a fan-shaped fold of the peritoneum. Mesentery, mes means middle, behind the jejunum and ileum of the small intestine to the posterior abdominal wall. It binds the jejunum and ileum. Mesentery is the fold of the peritoneum which binds the jejunum and ileum of the small intestine to the posterior abdominal wall. And finally, coming to mesocolon, it binds the transverse colon and sigmoid colon of the large intestine to the posterior abdominal wall. It also carries blood and lymphatic vessels to the intestine. Together, the mesentery and mesocolon hold the intestines loosely in place, allowing the movement as muscular contractions mix and move the luminal contents along the GI tract. This is the pictorial representation of various folds. The first one is greater omentum. The entire yellow color one is the greater omentum. It is lifted up. Usually it will be like this. The next is, here you can see in this diagram, the mesentery. It binds jejunum and ileum to the posterior abdominal wall. And the next is, here you can see lesser omentum. This one is the lesser omentum. And here you can see the falciform ligament. The white color one is the falciform ligament. It attaches liver to the anterior abdominal wall and diaphragm. And liver is the only digestive organ, accessory digestive organ that is attached to the anterior abdominal wall. Rest of all the organs are attached to the posterior abdominal wall only. Coming to clinical significance, we have discussed about peritoneum and folds of peritoneum. Now let us discuss briefly about peritonitis. Itis means nothing but inflammation. Peritonitis is the inflammation of peritoneum. Is an acute inflammation of peritoneum or contamination of the peritoneum by infectious microbes, which can result from accidental or surgical wounds in the abdominal wall, all from the perforation or rupture of abdominal organs. If, for example, bacteria gains access to the peritoneal cavity through a intestinal perforation, or rupture of the appendix. They can produce an acute, life-threatening form of peritonitis. A less serious but still painful form of peritonitis can result from rubbing together of the inflamed peritoneal surfaces. The increased risk of peritonitis is particularly in concern to those who rely on peritoneal dialysis, a procedure in which peritoneum is used to filter the blood when the kidneys do not function properly. The patients with peritoneal dialysis who undergo peritoneal dialysis are at higher risk for attaining peritonitis, which is nothing but the inflammation of peritoneum. Here you can see the order of the digestive organs. Mouth, it can be considered as an accessory organ or organ. From mouth to anus is the gastrointestinal tract. It is a hollow tract that starts from mouth and ends in anus. Gastrointestinal tract is also called as alimentary canal. So from mouth the food enters pharynx, then through pharynx into esophagus, from esophagus into stomach, from stomach into intestine, and intestine is again divided into large intestine and small intestine, and finally rectum, then rectum, and finally anus. This is the flow. Now, first of all, let us discuss about mouth. Mouth is also referred to as oral or buccal cavity. The mouth is also referred to as oral or buccal cavity. Buccal means cheeks. It is formed by cheeks, hard and soft palates and tongue. Mouth is formed by cheeks, hard and soft palates and tongue. The cheeks form the lateral walls of the oral cavity, and the buccinator or buccinator muscles and connective tissue that lie between the skin and mucous membranes of the cheeks. The anterior portions of the cheeks end at the lips. The anterior portion of the cheeks end at the lips, and they form the lateral walls of the oral cavity. Next, coming to lips. Lips or labia. The term related to lips is labial or labia, which is nothing but fleshy borders. Lips are the fleshy borders, are fleshy folds surrounding the opening of the mouth. They contain orbicularis oris muscle. Lips contain orbicularis oris muscle and are covered externally by skin and internally by mucous membrane. The inner surface of each lip, this is important, inner surface of each lip is attached to its corresponding gum by midline fold of mucous membrane called as labial frenulum. Frenulum is nothing but small bridle. And during chewing, contraction of the buccinator muscles in the cheeks and orbicularis oris muscle in the lips keep the food between the upper and lower teeth. And these muscles, they also assist in speech. Coming to the next part of the oral cavity, oral vestibule, palate and uvula. We will discuss about these three: oral vestibule, palate and uvula. First of all, coming to oral vestibule. Vestibule is nothing but entrance to a canal. So oral vestibule is the opening to the oral cavity. Oral vestibule of the oral cavity is the space that is bounded externally by cheeks and lips and internally by gums and teeth. And next is oral cavity proper. Oral cavity proper is the space that extends from the gums and teeth to the fauces. Oral cavity proper is the space that extends from the gums and teeth to the fauces. Fauces are nothing but passages. They are the opening between the oral cavity and the oropharynx. Fauces are the openings between the oral cavity and oropharynx. They are located in oropharynx. Next part is palate. Palate is mainly composed of two types: hard palate and soft palate. Hard palate is the anterior part of the palate and it is bony. And soft palate is the posterior part of the palate and it is muscular. Coming to palate, palate is the wall or septum. Palate is the wall or septum that separates the oral cavity from the nasal cavity and forms the roof of the mouth. Palate is a wall or septum that separates the oral cavity from the nasal cavity and forms the roof of the mouth. This important structure makes it possible to chew and breathe at the same time. So palate makes it possible to chew and breathe at the same time, and it separates oral cavity from the nasal cavity and forms the roof of the mouth. The hard palate. Coming to the hard palate, the anterior portion of the roof of the mouth is formed by the maxillae and palatine bones. Hard palate is formed by maxillae and palatine bones and is covered by mucous membrane. It forms the bony partition between the oral and nasal cavity. Next is soft palate, which forms the posterior portion of the roof of the mouth, is a arch shaped. You can see in the diagram at the end. Soft palate is an arch-shaped muscular partition between the oropharynx and nasopharynx. Partition between the, what is the muscular partition between the oropharynx and nasopharynx? It is soft palate that is lined by mucous membrane. Next, coming to uvula. Hanging from the free border of the soft palate. Hanging from the free border of the soft palate is a finger-like muscular structure called uvula. Uvula is nothing but, the meaning is little grape. During swallowing, the soft palate and uvula are drawn superiorly. During swallowing, the soft palate and uvula are drawn superiorly, closing off the nasopharynx and preventing the swallowed food from entering the nasal cavity. So, which part is responsible for preventing the food from entering the nasal cavity? It is uvula. And the lateral to the base of the uvula are two muscular folds that run down the lateral sides of the soft palate. Anteriorly, the palatoglossal arch. Folds are, first one is palatoglossal arch, which is anterior. It extends from side of the base of the tongue. And posteriorly, it is palatopharyngeal arch. It extends to side of the pharynx. Palatine tonsils are situated between the arches, and the lingual tonsils are situated at the base of the tongue. Palatine tonsils are situated between the arches, and the lingual tonsils are situated at the base of the tongue. Next, coming to salivary glands. Salivary gland is a gland that releases a secretion called saliva into oral cavity. There are some minor salivary glands also. In the current session, we are not discussing about them. In the current session, we will be focusing only on the three major salivary glands. Three pairs of major salivary glands. They are parotid glands, submandibular glands, and sublingual glands. The three major pairs of salivary glands are parotid glands, submandibular glands, and sublingual glands. The parotid glands are located inferior and anterior to ears between the skin and the masseter muscle. And coming to submandibular glands, they are found in the floor of the mouth. Submandibular glands are found in the floor of the mouth, partly inferior to the body of the mandibular. Sub means under, mandible, under the mandible. Hence the name submandibular. They are partly inferior to the body of the mandible. The next is sublingual, that is under the tongue. Lingual means tongue, sub means under. Are located beneath the tongue and superior to submandibular glands. These are the major salivary glands: parotid glands, submandibular, and sublingual. The saliva lubricates and dissolves the food and begins the chemical breakdown of carbohydrates and lipids. What is the function of saliva? It lubricates and dissolves the food and begins the chemical breakdown of carbohydrates and lipids. Here you can see the three major parotid glands, salivary glands. The first one is parotid gland. It is behind the ears. You can see this is the ear and this is the parotid gland. The next is Here you can see this is the sublingual gland, and inferior to it, this is the submandibular gland. Coming to the clinical significance, although any of the salivary glands may be the target of a nasopharyngeal infection, especially in case of mumps, which is caused by mumps virus, which is paramyxovirus. It typically attacks the parotid glands. Mumps is an inflammation and enlargement of parotid glands. Mumps is a inflammation and enlargement of parotid glands accompanied by moderate fever, malaise, that is general weakness or discomfort, extreme pain in the throat, especially when swallowing sore foods or acidic juices. Swelling occurs on one or both sides of the faces just anterior to the ramus of the mandible. Now coming to next part, that is tongue. Tongue is an accessory digestive organ composed of skeletal muscle. Tongue is an accessory digestive organ composed of skeletal muscle covered by mucous membrane. Together with its associated muscles, it forms the floor of the oral cavity. Roof of the oral cavity is formed by palate, whereas floor of the oral cavity is formed by tongue. And the lateral walls of the oral cavity are formed by cheeks. Tongue is divided into symmetrical lateral halves by a median septum that extends its entire length. If you observe the tongue, it is divided into symmetrical lateral halves, that is right side and left side, by a median septum, and it is attached inferiorly to hyoid bone, styloid process of temporal bone and mandible. It is attached inferiorly to hyoid bone, styloid process of temporal bone and mandible. And each half of the tongue consists of an identical complement of extrinsic and intrinsic muscles. Let us discuss briefly about what are extrinsic and intrinsic muscles of tongue. Coming to extrinsic muscles, they originate outside the tongue. Extrinsic muscles, they originate outside the tongue, hence the name extrinsic. They attach to bones in the area and insert into connective tissue in the tongue. Whereas intrinsic muscles, they originate in and insert into connective tissue within the tongue, hence the name intrinsic. Coming to the function of extrinsic muscles, they move the tongue from side to side and in and out to maneuver the food for chewing and shape the food into a rounded mass, which is nothing but bolus, and force the food to the back of the mouth for swallowing. They also form the floor of the mouth and hold the tongue in position. These are the functions of extrinsic muscles. The names of extrinsic muscles of tongue are hypoglossus, genioglossus and styloglossus muscles. Next, coming to intrinsic muscles. The function is they alter the shape and size of the tongue for speech and swallowing. Intrinsic muscles, they alter the shape and size of the tongue for speech and swallowing. Examples or the names of intrinsic muscles of tongue are longitudinalis superior, longitudinalis inferior, transverse linguae, verticularis linguae muscles. One more important part of the tongue is lingual frenulum. Lingua means tongue. Lingual frenulum is a fold of mucous membrane in the middle of the undersurface of tongue and is attached to the floor of the mouth and aids in limiting the movement of the tongue posteriorly. Lingual frenulum aids in the movement of the tongue posteriorly. It limits the movement of the tongue posteriorly. It is attached to the floor of the mouth. If a person's lingual frenulum is abnormally short or rigid, a condition called as ankyloglossia occurs. If the lingual frenulum is abnormally short or rigid, it causes ankyloglossia. The person is said to be tongue-tied because of the resulting impairment to speech. The next is dorsum. dorsum, that is the upper surface and lateral surface of the tongue, are covered by papillae, which contain taste buds and receptors for gustation. Gustation is nothing but taste. Some papillae lack the taste buds, but they contain receptors for touch and increase the friction between the tongue and food, making it easier for tongue to move the food into the oral cavity. These are the various parts of the tongue. Now coming to teeth. We are not going into details regarding the teeth. Briefly, we will discuss types of teeth. Teeth or dents, they are also called as dents, are accessory digestive organs located in the sockets of the alveolar processes of the mandible and maxillae. Location of the teeth is sockets of the alveolar processes of the mandible and maxillae. The alveolar processes are covered by gingivae. Gingivae is nothing but gums which extend slightly into each socket. And the sockets are lined by periodontal ligament. Periodontal ligament, which consists of, odonto means tooth, periodontal means around the tooth. It consists of dense fibrous connective tissue that anchors the teeth to the socket walls and acts as a shock absorber during chewing. So what is a shock absorber during chewing? It is periodontal ligament. Coming to the regions of a tooth. Any typical tooth consists of three regions: crown, root and neck. Crown is the visible portion above the level of the gums, and root is embedded in the socket. Embedded in the sockets are 1 to 3 roots. Some teeth may contain 1 and some teeth may contain up to 3 roots. The next is neck. Neck is the constricted junction of the crown and root near the gum line. These are the major regions of any tooth. Here you can see the teeth are anchored in sockets of alveolar process of mandible and maxillae. This is the crown, visible portion. Between it, root and crown is the neck. And finally root and some more parts we will be discussing here. Enamel. Enamel is made of calcium salts. It protects the tooth from wear and tear. And enamel is the hardest part of the body. Next is dentin. Here you can see dentin. It is the calcified connective tissue, makes up the majority of the tooth. And here you can see this is the gingiva, which is nothing but gum. And this area is the pulp cavity, contains pulp. That is nothing but connective tissue containing nerves and blood vessels. The next, the white color one here, it is the cementum. It is a bone-like substance that attaches the root to the periodontal ligament. Cementum attaches the root to the periodontal ligament. And this lines one is the periodontal ligament that helps anchor the tooth to the underlying bone, and it also acts as a shock absorber when chewing. And here is also apical foramen. It is an opening at the base of the root canal through which blood vessels, lymphatic vessels and nerves enter a tooth. Apical foramen is an opening at the base of the root through which blood vessels, lymphatic vessels and nerves enter the tooth. Now coming to branches of medicines which deal with disorders of teeth. First one is endodontics. Endo means within. The branch of dentistry, that is, dentistry is nothing but which deals with the disorders of teeth, and dentistry is divided into some more branches. Here we will be discussing about 3 main branches. First one is endodontics, the branch of dentistry that is concerned with the prevention, diagnosis and treatment of diseases that affect the pulp, root, periodontal ligament and alveolar bone. The next is orthodontics. Ortho means straight. It is a branch of dentistry that is concerned with the prevention and correction of abnormally aligned teeth. And finally, periodontics. Peri means around. It is a branch of dentistry concerned with the treatment of abnormal conditions of the tissue immediately surrounding the teeth, such as gingivitis, which is the inflammation of gums. Now coming to types of teeth or dentitions. We all know that we have 2 types of teeth. Teeth and permanent teeth. The milk teeth or primary teeth or baby teeth are also called as deciduous teeth. Deciduous is nothing but falling out. And the permanent teeth or secondary teeth are 32 in number. Now coming to types of permanent teeth, there are mainly 4 types: molar, premolar, canine and incisors. Incisors, they aid to cut the food. Canine, they tear and shred the food. Premolar, they crush and grind the food. Even molars and premolars both crush and grind the food. Premolars, they are mainly composed of 2 cusps. Hence, they are called as bicuspids. Whereas canines are composed of single cusp. Hence, they are also called as cuspids. Here you can see this is the diagram of the entire oral cavity. The mouth is formed by cheeks, hard and soft palates and tongue. And this is the superior lip and this is the inferior lip. Both superior and inferior lips are attached to the respective gums. Here you can see these are the gums by superior labial frenulum that attaches the superior lip to the gum and inferior labial frenulum that attaches the inferior lip to the gum. The next is these are gums or gingivae. Next coming to palate. Palate forms the partition between the nasal cavity and the oral cavity. It is mainly composed of 2 parts. Anteriorly it is hard palate and it forms most of the roof of the mouth. And posteriorly it is called as soft palate. Here you can see the soft palate is an arch-shaped muscular structure. It forms the rest of the roof of the mouth. And hanging from the soft palate is a finger-like projection which is nothing but uvula. This is the uvula. This prevents the swallowed food from entering the nasal cavity. And these are the cheeks. They form the lateral wall of the oral cavity. Roof is formed by palate, lateral wall is formed by cheeks, and the floor is formed by tongue. And these are the molars, and these 2 are the premolars. Molars, they grind the food. Premolars, they crush and grind the food. And these are the canines, which tear the food. And these 4 are the incisors, which cut the food. And the space, the entire opening of the mouth or oral cavity is the oral vestibule. It is the space between the cheeks, lips, gums and teeth. And here you can also see fauces is the opening between the oral cavity and the oropharynx. And this part is the palatoglossal arch and this part is the palatopharyngeal arch. And here are the palatine tonsils between the arches. And here you can see this is the tongue. It forms the floor of the mouth, manipulates the food for chewing and swallowing, shapes the food and senses the taste. And lingual frenulum is the part of the body which limits the movement of the tongue posteriorly. And if lingual frenulum is rigid or short, it causes ankyloglossia. Here you can see gums cover the tooth socket and help to anchor the teeth. These are the entire parts of the mouth. Now coming to pharynx. Pharynx will be discussed in detail in respiratory system. Here we will be just discussing the basics about 3 parts of pharynx. Pharynx, it is also called as throat. It is a funnel-shaped tube that extends from the internal nares to the esophagus posteriorly and to the larynx anteriorly. The pharynx is composed of skeletal muscle and lined by mucous membrane and is divided into 3 parts. The 3 parts of pharynx are nasopharynx, oropharynx and laryngopharynx. Laryngopharynx is also called as hypopharynx. The nasopharynx functions only in respiration, whereas oropharynx and laryngopharynx, they have both respiratory and digestive functions. One more important point is nasopharynx houses pharyngeal tonsil or adenoid. Adenoids are located in nasopharynx, whereas palatine and lingual tonsils are located in and fauces are located in the oropharynx. The swallowed food passes from the mouth into the oropharynx and laryngopharynx. The muscular contractions of these areas, the oropharynx and the laryngopharynx, help propel the food into the esophagus and then into the stomach. That is the digestive function of oropharynx and laryngopharynx. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.